Well, good morning, good afternoon, good evening, public safety community. Welcome to the Public Safety Network's PSN Now News of the Week. All the news that's fit to be shared on this internet webcast. See what I did there? I'm Jason Karp, Esquire, your host, along with my good friend and colleague, Teddy Roosevelt Kennedy, otherwise known as TJ. TJ, how's it going, man?
I'm good. Good to be here with you today.
Yeah, I appreciate you coming. You know, it's nice to be able to have you on every once in a while, and you kind of just kick around some of the latest and greatest news stories. You know,
maybe we should do this like once a week or something.
I knew you were the idea man. He is the idea man. Let's rock this out. We've got our Independence Day edition, which means we're going to talk about just whatever's happening this week. And Independence Day is coming up. So that's how that, you see how we did that? See how I put that together? Because independence. Anyway, in the news, starting with our COVID update. I love this. Well, that was scary, according to Dr. Fauci's testimony in front of Congress yesterday. We are approaching 100,000 cases a day. We're at the fastest growth of cases that we've seen so far as the country reopens. And although we are seeing pockets, especially in the South and in the West, obviously the risk is to the entire country. So again, nothing new, but we have to stay very, very vigilant. And of course, as we know, it's starting to infect the younger population, most likely because they are getting out and about. I know here in Loudoun, we just had Beach Week, and 20 students just came back, all diagnosed positive, coming back from Myrtle Beach, South Carolina.
Where are the beaches in Loudoun County, Virginia? I didn't believe they had beaches.
Well, not in Loudoun County per se, but so traveling down to South Carolina, which I know is one of the hot spots. But in fact, I went to the doctor this week, and one of the screening questions was, have you been in contact with anybody recently from Myrtle Beach? So that's now a screening question. So that gives you any indication of kind of what's going on here. So obviously, we need to continue to be careful. And as Dr. Fauci, put it in a much more eloquent way, much more polite than I'll say it is, wear your masks. That's going to make a difference. And the social distancing must continue. Social distancing must continue. That's why TJ's all the way on the other side of the studio, and I'm all the way on the other side of the studio. Do you see how we're doing this? So, perfect example. So, anyway, things are so bad. We had talked about, we previewed this, but now it's official. EU is opening their borders, but not to the U.S. The U.S. has 4% of the population, 25% of the coronavirus cases. You don't have to be a mathematician to understand that. That doesn't quite line up. So we need to get our act together and really watch this stuff. Is this real? We've got people talking about school already and not opening schools in the fall. So anyway, folks, we just got to beat this thing. I know it sucks. We got to do what we got to do. We got to keep our first responders and our health officials and our doctors and our nurses and our grocery store clerks. We got to keep them safe so that we can all keep doing what we're doing. And that's it. I'm done. That's all I'm saying about it. I'm not going to say anything else except wear your masks. Anything to add, TJ?
No, let's move on to the impact to emergency medical services calls that we've seen some significant news in the past week. A recent study out shows that EMS calls during the COVID pandemic are down 26%. And it's not having a good outcome for patients on the other side of this. I think at the end of the day, it is easy to determine from the data so far that patients are probably less willing to call 911 and less willing to be, leveraging the appropriate emergency medical services because they're worried about catching COVID. Why, at the same point, these are probably the best decontaminated units and way to be transported by people who actually know how to handle coronavirus better than most. And one of the worst things, it sounds like, is that people who are the sickest, and it could have nothing to do with COVID. It could be a cardiac event, it could be a stroke, it could be other things that normally they would have called for emergency services. They're not. And the percentage of deaths from these cases are spiking dramatically from non-coronavirus related medical incidents. The cardiac arrest rate is just skyrocketing from a deaths from those cardiac arrests versus normal, because of the normal EMS interventions are not occurring. So I just think this is tragic.
No, absolutely. And again, another statistic, and I'm being a former engineer and a math person. I love my analytics, love my statistics. Lower 911 calls, higher death rate. Again, that is not a good equation. And obviously, we've talked about this in the past, as you said. The truth is, these facilities, and certainly the hospital facilities, are taking tremendous precautions to protect patients coming in. So again, my message continues to be to EMS agencies, to hospitals, is to publicize this to the community. I think that's really important, because folks, apparently, they're staying home and they're probably fearful of making those calls, and it's leading to really bad outcomes. And so it's incumbent upon all agencies and hospitals to reach out to their communities and ensure they know what they are doing to keep them safe, and that they need to go to the hospital. The other thing is, this has much bigger, longer term ramifications, right, on the continued viability and the economics and the financials of these EMS agencies, right?
Yeah, I mean, revenues are way down. Obviously, all EMS agencies, for the most part, charge for their EMS transports, and this is a part of their operating revenue to be able to run a 24/7 service. And if their call volume's down 26%, we could assume that their revenue is down at least 26%, which is going to have a significant impact on not just private ambulance services, which obviously are relying on those fees to operate completely, but also on some of the fire departments and other services that leverage the billing of insurance companies and Medicare if there's less calls. So that this will have both a short-term and potentially a longer-term impact on two things. One is the availability of emergency medical services in your community, because they need the revenue to actually be able to operate. But even worse so, the long-term impact on those citizens who are not leveraging those services and are having worse outcomes. And, we learned a long time ago that advanced life support being applied early and being able to be leveraged for cardiac care and the right drugs and the right interventions and the right tools and technologies that are going to help save them and get them to a hospital, both in a speedy manner, but also in a state where they can, immediately go to a cath lab for a cardiac patient, as an example. Those things won't happen if people wait, and if they eventually show up in a waiting room at an ER. That is not the most efficient and effective manner to be treated for a life-threatening kind of illness.
Yeah, it may seem counterintuitive to the average citizen, but I think the message of the day is use it or lose it. You actually need to use these services, or they're not going to be able to maintain their funding to continue to provide the kinds of services that when you do need them, they're available. Use it or lose it, people. Let's go. Make the calls. Keep yourself safe. All right, moving on. A lot going on in the world of public safety communications. Some really good news with FirstNet and some of the build out and expansion programs across multiple states now. I know there's been significant build out going on in Maryland locally, some new purpose-built sites up in Vermont, and a continued expansion which started several years ago and continues in Florida, which is having, I think, a very tremendously positive impact, not only on public safety, who now has access to priority and preemption in these areas, and a public safety ecosystem, applications ecosystem, but because this infrastructure supplements the commercial infrastructure, it also gives better coverage to the citizenry in the states as well.
No, it really does. And one of the things you're seeing, now that we're moving into that last 20% of additional deployment of Band 14 and really public safety's network throughout the country, is that you're seeing those spots that were very rural have now been permitted to, put in additional new cell sites and additional capacity and additional coverage. And this is where I think you're going to see some exciting new events. I mean, I saw, just knowing the Maryland area, for example, Tillman Island was on there as a new cell site that was built last year. Now you're seeing, many other rural counties that are getting additional sites. These are areas that traditionally have had no cellular coverage at all. And not only are they getting it for emergency services, they're also getting it for citizens, who want to sign up and they can leverage 911 like we were talking about a minute ago, now that they have coverage and can actually connect. So I think this is going to have significant impact on communities. I think it's obviously going to have a positive impact on public safety operations, and getting more coverage across the country and having it that has priority and preemption obviously is critical. So very, very excited to see this happen.
Yeah, and for those listening, for those who either aren't leveraging FirstNet yet or having coverage issues, so just in Maryland alone, to your point, we've seen new infrastructure cell sites purpose-built for FirstNet, as well as being able to use by consumers. Band 14 in addition on all of these sites. Allegheny County, Calvert County, Charles County, Dorchester County, Garrett County, Queen Anne's County, St. Mary's County, in Wicomico County. And as TJ said, it was Tillman Island, and then Baltimore was also supplemented last year. So that's just in the state of Maryland. Significant areas where coverage existed, but now has been supplemented with significantly better, and newer infrastructure. So that's really exciting. I mean, we all know Maryland is not a particularly large geographic area, and you can see the kind of investment that's being made. As you know, FirstNet, the authority, recently announced at a board meeting a couple of weeks ago about several $100 million investment they're going to be making in addition into the network now going forward, which was the model that we put together, right? This is exactly what we had anticipated seeing, and now we're starting to see that come to fruition.
Well, beyond even the expanding coverage, which was always in the plan and has been done for the past 2.5 to 3 years now, also seeing going beyond that with additional coverage, seeing reinvestment in the network with new coverage, more deployables, and then lastly, already now funding to upgrade to the 5G core for first responders. And so, public safety has always had a hard time finding funding when it comes to improve and upgrade those kinds of investments that are large capital expenditures. And because of the model, it is built in and it is happening automatically without any additional need to go find new funds to make that happen because of the reinvestment that's required as part.
Yeah, it's fantastic. And plus, in the initial commitment of $40 billion in infrastructure and cash and other things by AT&T in Vermont, 62 new cell sites have been added in 52 towns.
That's amazing. It's just spectacular.
And then you've got purpose-built Band 14 in North Bennington and West Bridgewater. I mean, it's just, and I'm identifying the specifics because I think it's important. We talk about this very theoretically, but this is actually what's happening in these towns. And so, those of you who feel like you don't have the necessary coverage with FirstNet at this point, my expectation is either coming, and if it's not, or you're not aware of it, reach out to them because they are making this investment. And it's important that everybody in this country have access to this purpose-built public safety network, period, end of story. That doesn't mean you can't use other networks. It doesn't mean other networks aren't good, but you have to have access, the ability to leverage and access this network everywhere, period. I mean, that's what the purpose of this was. So a lot of great stuff going on there. Go ahead.
One more thing on that is we have another country now that has announced they're following the FirstNet kind of model, and it's always exciting to see another one go down this path. Sweden had a big announcement in the past week that they are investing in the next 2 years to build a public safety broadband network across the country of Sweden to leverage carrier infrastructure to do that, and to do this as a future replacement for Tetra down the road. They're a Tetra user today, but making sure that they build in the appropriate public safety priority preemption, encryption, and mission critical push to talk in the future. And so it's nice to see countries continuing to fund those efforts and to continue to go down a path where they know they need a nationwide public safety broadband network. And it's always fun to see another one commit to doing that at the national level.
That's fantastic. We talked about Finland obviously several weeks ago, and we know there are significant efforts going on in New Zealand and other places around the world that are really, looking at the U.S., in terms of the modeling and trying to do something very similar. And it's great to see, and it's about time, right? I mean, the long and short of it is this just happens. It has to happen globally. So, great news. I know there are also a lot of hurricane investment continuing to go on down in Florida. That was another, a piece of news that's going out, at least with FirstNet, and I assume with others, are reinforcing their existing infrastructure, continue to add expansion and new sites, turning on here 37 new cell sites down in Florida, activating 44 new DAS, distributed antenna systems. So again, not just to have it, but also, as we know, we're now at the very beginning of hurricane season. And, God forbid, right? I mean, we get a terrible hurricane season on top of a pandemic, on top of social unrest, and on top of what's, wildfire season. I mean, 2020 is going to be a year. So our infrastructure has to be ready. And it's nice to see that folks are thinking ahead and making at least those investments to keep our first responders and our citizens safe.
No, it becomes even more critical if you go into hurricane season. Wildfire season's already in full swing. Have to give my friends down in New Orleans the credit for, I think they churned Hurrivirus. Would not be a good thing where they're dealing with coronavirus and hurricanes at the same time. And I think we need to be really smart about this. And, it's going to have effects on when you think of shelters and other things where we have large amounts of people that move when these big events have massive, natural weather effects on their communities. So important to prepare now, not wait, get the right communications in place, the right technologies, the right pre-planning, the right PPE to be able to handle those events. Now's the time to plan.
Absolutely. And, one last point for those who are unaware, and I know a lot of folks are offering promotions, but, as with the FirstNet program, they are also offering free smartphones for life. So when agencies are signing up, there are certain programs there where, you've got guaranteed upgrades of smartphones for, the rest of your working life, at least currently under the existing plan. So doing everything that they can, and I know other carriers are doing, similar things as well, to make it easy and to make it affordable for public safety to get to the resources they need. So that's great. Speaking of DAS systems and speaking of FirstNet and connectivity, we've mentioned this in the past, but I know there's a recent article about this, and so I just wanted to kind of bring it up and get your thinking on where we are on this, TJ. DAS, distributed antenna systems, in-building coverage. It's been a challenge, certainly with land mobile radio for many, many years. It's a challenge in some cases with broadband, and so in some cases it's much better, but in other cases, there's, when you have wall thickness and, just poor engineering, even with DAS systems, may have difficulty communicating, and you may have this great network in FirstNet or otherwise, and you get into a parking garage, you get into a thick building, and all of a sudden you lose some of the benefits of that. So, where are we on that? What's the approach? What are the concerns, and how should folks be thinking about that as we move forward to make sure that they're getting the coverage they need?
Well, like you mentioned, I think land mobile radio struggled for the past 30 years to convince commercial business owners to install, elements inside of the building to add both the antennas and the infrastructure to drive land mobile radio capabilities that are in the sub-basement or in the concrete buildings to be able to work better. Some big cities like New York and others have done better with this, but most of the country not so great. So that's had a huge effect on in-building coverage for land mobile radio, especially digital land mobile radio. I think for LTE, we've been very positively surprised by both the existing deployments of distributed antenna systems that are pretty common. I mean, I work in a small 5-story building in a mid-sized town in America, and I can tell you on AT&T and FirstNet, spectacular coverage and signal strength inside of this building, great distributed antenna systems, and we didn't pay to install those. The landlord thought that was a good thing to be able to support business that works out of this as well as public safety that responds to this building. So I think it's fairly darn common, which is good, but I think there's always more that can be done, and I think you're seeing good work being done by the Safer Buildings Coalition, who's driving more and more capabilities into these solutions. John and the team over there, I think, really have been pushing some good efforts. I think you're seeing all carriers continue to add distributed antenna systems to commercial infrastructure, and I think that's important. It should continue every day into the future, and I think that job will never be done because there will always be new buildings going up. There will always be renovations happening, and I think that we should continue to push both as citizens and on the public safety side that having good distributed antenna systems in building is an important thing because it does drive better responses and better use of broadband. Also, we need to continue to give our first responders the best tools to go into buildings and make sure that they have the right connectivity.
Absolutely. And I would, be remiss not to mention, as we all know, there was an announcement this week from Ilario, which, you and I both have an interest in, but it is very newsworthy. Lario, which offers effectively a portable mobile connectivity hub for broadband that can travel anywhere, in building, in the vehicle, on with a paramedic, wherever it needs to go. A lightweight portable device that taps into multiple LTE networks to find the best coverage automatically. And so a tool like that, which is now available, also is something that I think can supplement communications needs for all first responders, and certainly for EMS, because that's where they're administering their service. They're going to be in the house, they're going to be in a building, they're going to be in a parking garage, and if they don't happen to have easy, clear, strong connectivity for whatever reason, having a tool like an Alario Hub can supplement that and get them the kind of information and give them the capabilities they need to offer service.
Absolutely. I mean, it's 2020. We have to provide first responders with the right tools, and things like the Alario Hub being able to be taken in on every emergency call is going to really help emergency responses, as well as, think of telemedicine at the bedside, whether that's in a home or an apartment. You've got to have the ability to have strong two-way video as part of that today. That's an expectation, and it's really changing the way that we can share rich data for emergency response.
Excellent. All right. Well, with that said, I think we're gonna call it quits today. We've got a lot, for some, hopefully a long weekend coming up. I want to wish everybody a very, very happy Independence Day and 4th of July. Please stay safe. There's, as we know, there's always issues with fireworks, and in particular, this year with kind of limited availability to go see outdoor venues and professionally administered events and firework events. Many folks may be doing these stuff at home, so please be safe, follow the rules, listen to your public safety advice and local authorities' advice on that. But for everybody, have a drink, eat some hot dogs, have some apple pie, take a deep breath after everything that we've been going through. Enjoy this wonderful country that we live in. And on that, I'm Jason Karp with my good friend TJ Kennedy. We're going to sign off. We're going to leave you with a couple minutes of a wonderful rendition of the Star Spangled Banner that was sung by a Portland State student, Madison Hallberg. But what made it special is halfway through, a stranger who's apparently an opera singer, socially distanced, joined her in a beautiful rendition of our national anthem. So please listen to that, and everyone have a wonderful weekend.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled